Alright, let's dive into this. Imagine caring for a family member whose mental health is deteriorating day by day, but every time you reach out for help, the system slams the door in your face. That's the reality for Michael's parents in Somerset, a couple in their 70s, trapped in a nightmare with a son who's battling autism, psychosis, OCD, and physical health issues. He's setting fires, refusing food, and seeing aliens in his own family. And the worst part? They are told there's nothing anyone can do until he becomes an immediate risk. Wait, what? How is this the standard? Let me break this down. The Thomases aren't just dealing with their son's illness, they are fighting a mental health system that's designed to fail people like him. The MP involved, Tessa Munt, calls it a walloping great gap between crisis care and mild support. But here's what bugs me. Why does society only act when someone's already in a full-blown emergency? We are talking about human lives here, not some bureaucratic checklist. If you wait for a person to become a risk, you're guaranteeing tragedy. How many more families have to live in this limbo before someone listens? And let's talk about the least restrictive environment mantra from the Department of Health. Sounds noble in theory, until it becomes an excuse to abandon people who need structure. Michael's parents are his caregivers, not because it's ideal, but because there's no alternative. They are not clinicians, they are elderly parents watching their son unravel. The system's so stretched that even basic interventions, like a mental health bed, have become mythical. SANE's founder points out the elephant in the room: decades of cuts to mental health resources. So we've created a system where families are the last line of defense, and they are crumbling under the weight. Here's the deeper issue: mental health isn't treated like physical health. If Michael had a heart attack, they'd rush him to a hospital. But because his crisis is in his mind, he's stuck in legal purgatory. And this isn't just about Michael. It's about the 1 in 4 people who'll face mental health struggles in their lifetime. How many more stories like this are brewing under the surface? The government's new strategy promises earlier intervention, but words won't fix broken systems. What's the point of a mental health strategy if it doesn't address the middle ground, the space where people aren't sick enough to qualify for help, but too sick to survive alone? I'll leave you with this: the Thomases' story isn't just a tragedy. It's a mirror. It shows us how we've prioritized cost over compassion, bureaucracy over humanity. Until we treat mental health as foundational, not optional, this cycle will keep repeating. So ask yourself, if this family's hell could have been prevented, what does that say about the rest of us? Let me know your thoughts in the comments. And if you're struggling to find hope here, share this video. Maybe if enough people see it, the system will finally stop waiting for the next crisis to act.